Welcome, Jocelyn Center Facebook fans. This is our Friday interview show. Doing it from home because as summer is here in the desert, so are air conditioning repair people. Unfortunately, that's the situation I'm in today, but welcome you to the show. Before we talk with our guests about long-term care ombudsman program, I want to go over a few of the things that are coming up with the Jocelyn Center. One thing I want to remind you all, we do have a policy where you need to wear your mask. So when you come in and enjoy the programs and services, please check in, sign in, take your temperature, wear your mask. And especially with this Delta variant going on, we want to make sure that you're all safe. So Zumba is back on Mondays and Fridays at 8 a.m. So that's something you'll want to do. Also, our Jocelyn Go for Life class, Mondays through Thursdays at 8 a.m. and that one's free. So if you want to join in that class, you can call us at 760-340-3220 and ask for Melanie, and she will get you enrolled in that class. Unfortunately, we are still having to keep physical distancing requirements in place, so class sizes are limited. We have bridge lessons. So the season's coming up, bridge is going to be a big deal. So we have bridge lessons in place of our bridge or social bridge group. And that's starting Monday, August 16th at 12 noon and it'll continue through September 13th. So you have about a month of bridge lessons and it only costs $3 per lesson. There's no better deal in town, trust me. And then if you're a pickleball fan, you can do pickleball lessons at the Jocelyn Center. And we also have open pickleball court, and it's air conditioned in our auditorium. So the pickleball court is on Friday at 10:30. And then the pickleball classes are Wednesday and Friday at 9:30. Then also, just to remind you, our wellness center is open and accepting individuals. If you're under a lot of stress with what's happening with COVID today, or things that are just coming back out and getting back involved in the community and you're finding it stressful, our problem-solving strategies counseling program can really help you with that. It's free. And we encourage you to join in on that. And then also coming up, and you can check our website on this, our Brain Boot Camp, 2-session course. That's from UCLA. It teaches you things about how to keep your brain healthy and learn new memory. So that covers the things that are happening at the Jocelyn Center. This morning, I'm really happy to introduce from the Council on Aging Long Care Ombudsman Program. We have Mary Jane Leonardi and Mary Sturm, and they are here with us to talk about that program. So they're joining us. Welcome.
Thank you.
Good to see you.
Yeah, great to be seen. I'm glad we could do it this way. It's so great.
Yes. So tell us about what the long-term care ombudsman program is, because a lot of people don't know what that term, even ombudsman, means.
That's right. I didn't know what it meant until I was started with this position. It's a Swedish word, actually, and it means an advocate. We advocate, and there's several different kinds of ombudsman for like a dealership, car dealerships, for hospitals. There's a lot of different kinds of ombudsman, but we are long-term care ombudsman, and we advocate for the residents that are in licensed, skilled nursing, and assisted living facilities. So we're their voice. We go and check on them and do unannounced visits and help to resolve concerns and complaints that are happening. And it's all confidential, very private, so they don't have to worry that there could be retaliation or something like that. But it was started back in 1973 when they realized there was a lot of complaints of abuse and things happening in the nursing homes. And the president of the United States at the time decided that he had to do something about this. And so he created the program, and there's a state ombudsman in every state. And then there's programs within that state, depending on how many people are there. And in California, we have 35 programs. And our program is under the Council on Aging, which is in Irvine.
So how many, let's say just in the Coachella Valley, that's where we're located, how many long-term care communities or nursing homes or nursing facilities are you charged with overseeing?
We're over all of the assisted living facilities and the skilled nursing facilities in the Coachella Valley area. And that goes from Palm Springs, Sky Harbor, Desert Hot Springs, clear over. We have a facility in Blythe. And there are approximately 115, I believe, assisted living facilities. And then there's 12 skilled nursing facilities where there's residents that need more care, that have just come out of the hospital or something like that.
And Mary S., I understand that your visits are unannounced.
Yes, we are able to go in at any time. That's part of the state law. And so if we get a serious complaint, we're not going to announce that we're coming over. We want to be able to talk to that resident and find out what's going on, or to their POA, so power of attorney. So those are usually unannounced visits. There are times that I do say I'd like to come by, especially for the 6 beds. Their days are pretty structured, so I want to get there while the residents are up, not taking a nap or getting bathed or anything like that. But again, I can go in at any time. So
if someone has a complaint, it could be something you observe, or if someone has a complaint, how would they get in touch with you?
They call well, in the facilities, there's a poster, a great big poster, and I believe you'll be sending that out so people can recognize it. But that's in the facilities. And then also people, which we're trying to bring more awareness to, they can call the Ombudsman line, and then our call center will reach out to the Ombudsman that is close to that facility that oversees those facilities. And then we go out after that to work on it.
Now,
there's also a crisis number too, that is 24 hours. So there's a number for that also.
So the resident can call. How about a family member or someone who thinks or a friend who thinks something just isn't right, that what they're seeing?
Oh yeah, we encourage it. Family member, any representative of the person that sees something, and or someone that has power of attorney over that resident, because a lot of them they're just also vulnerable in where they are, and a lot of them can't speak for themselves. So we definitely, want to hear from their loved ones and the people that represent them.
So Mary S., in the event you do receive a complaint, what's kind of the process that you follow at the nursing home or long-term care?
The first thing that I'm going to do is read the complaint. The people who do the intake will get as much information as they can. Once I kind of have a feel for it, if the resident is able to speak for themselves, then I ask if they have a phone number. I will give them a call and say, I'm Mary the Ombudsman. I would like to come by and visit you, to ease it, not to say, I understand there's a complaint. I want to just say, I want to come visit you. From there, I'll go to the facility. And again, if the resident is able to speak for themselves, then I'll listen to them. It's important that it's private. It's important that if there's somebody else in the room, maybe we can use the dining room, or sometimes they have visitor rooms, so that we can speak privately. And there we can resolve it. It can be something as simple as my coffee's not hot in the morning and I like hot coffee, to the night shift is very rough with me and I have bruises. So there's a wide range of different complaints. And the coffee one is real easy to solve. I talk to the dietitian. She'll say, yes, I'll get her some hot coffee, and then it's done. The other takes some investigation, talking to the social services, talking to maybe some of the CNAs on the night shift, things like that to see what's going on.
I went to your website and I saw your mission, and I think it really states it succinctly as to what you do, and that is promoting the independence, health, and dignity of older adults through compassion, education, and advocacy. So, as I understand it, when you visit these facilities where people are living, you try not to make it an adversarial process.
Oh, definitely not, because we want to work together with the facilities for the care of the residents. We need these facilities, but we just want to make sure that they're taking care of the rights that they have and making sure that they're giving them the care that they need. So we definitely want to, and recently we've been reaching out to the facilities and having a presentation at the facility, meeting with their staff and talking about what we do. And so many of them don't even know what an ombudsman is. So when they see us come in, they probably get scared or whatever, because we have our badges and things on, and we don't want them to feel that way. We want them to know that they come to us and that we can give them help with, instead of it going up to a higher level, up to the licensing or law enforcement, we can definitely help.
And that's one thing that I think you educate the staff on, that if they see something that they're uncomfortable with, they can report it as well, even though and it's kept confidential, even though they're employees.
Correct. Yes. Anonymously. Yes. We encourage that because they see it the closest, right? So, but we do really work on having a good relationship with the facility so that we can, talk to the people and they know us, and it just works out so much better that way. And working on the education of the community, like what we're doing now, it's just so great to bring awareness to the community about what we do, so that when you have a loved one in one of these facilities, you can turn to us before you want to call the news or someone else. We can help to resolve that issue.
So how would they get in touch with you?
They can call that number that's on the poster, or I gave you, there's a slip of paper that has our different emails and the complaint line number or the ombudsman number. Do you want me to give you that number, or do you want to send it?
Sure. Let us know now. What is that number that they can?
Oh, okay. Okay. So the best number is 833-772-6624. And that's the best number to call. And then there is a crisis line number. Hold on, let me find that one. It's an 800 number. And that is 800-231-4024.
And what we'll do when we post and edit this for Facebook, we will put those numbers and information in the text part of it so people can see it.
Wonderful. Yeah, and I put our emails there too, myself and Mary's, so they can contact us that way also.
So it sounds to me, if it's just Mary and Mary here in the Coachella Valley, that and all those places that you are responsible for working with, that you might need some help.
Oh boy, yes. Thank you for bringing that up. We definitely do. Because like I said, we've got like over 115 of the assisted living facilities and then 12 skilled nursing. And it's Mary and myself and another paid staff. And then we have 3, soon to be 4 volunteers. And one of them is on your board there, Pam Elliott. She's coming on. I just met with her this morning and she's going to be so great for our team. But we do need volunteers, and it's such a rewarding thing to do. Takes about 36 hours of training, and then you get your certification, and then there's 18 hours of continuing education that you have to do a year, and then and then you have to agree to doing a minimum of 20 hours a month of your volunteering.
Okay.
Which should be a piece of cake, right? And it's just so rewarding. I mean, I've just had so many interesting people that I've helped, and they've been so appreciative. This one little gal in a skilled nursing facility, she had ALS, and she could still move her arm, but it was very thin, and her hands were contracted, but she could write on a grease board about what she needed and the help that she needed. And we were able to get her the help that she needed. And because she was at the end of the hallway, she was being a little bit neglected. And anyway, we do such a wonderful job. Mary, I'm sure you've got maybe a case that you might want to share.
I had one gentleman who stole my heart. His name was George, and his partner passed away, and he was left alone out here in the Palm Springs area. And all George wanted was to get home, to go back to Pennsylvania, where his partner was laid to rest. And I was able to work with the family, work with the facility, and we had one of their friends from San Francisco fly in, take George to Pennsylvania. And I just got a card from George the other day with him having a little picnic in the cemetery with his partner. And he just touched my heart. And that's one of the things that you'll find is, as much as you think, oh, I'm going to give all of this, you get so much back. Just a touch of a hand sometimes is all that these residents really need, especially coming out of the COVID time. They were so isolated. And so I get much more than I give. I kind of feel guilty about that, but I get a lot of love back. And it's just a really rewarding. And I was a volunteer first and then came on as staff. So.
Well, we're very proud of Pam for volunteering.
Yes.
No. Do you mind if I share another story?
Oh, please go ahead.
Oh, great. Okay. There's another little ALS gal that I met, and she needed a lot of help, and she wanted to transfer, and she could speak with her eyes through the computer. It was amazing. And she would have the CNAs and the nurses dress her every day. She was more well dressed than any woman, actually, with scarves and jewelry, and she'd get her nails done. And she just had the best attitude. Oh my gosh, she couldn't move, right? And then we were able to get her transferred to a congregate care home, I believe it's called. And it's like a 6-bed, it's a home. And she looks out her windows and sees the hummingbirds, and she sees the squirrels and the cat, and she's so happy. Oh my gosh. She even had a virtual birthday party. She had a magician there and all this stuff. And I mean, it makes me so happy that I could help her do that. And then I had another gentleman that, because of COVID, he and his wife were separated because she was in Hemet and he was in a facility in Palm Springs, and he was getting very sad and he had a lot of anxiety, and they were trying to get the trach removed, but he had so much anxiety that it was really difficult with that. And so he wasn't talking to his wife. They used to have visits on the phone every day. And so she was crying and calling me, "You've got to go check on him. I'm really worried about him." And so I went there, and just when you hold these people's hand, look into their eyes, it's just like, oh my gosh. And I just said, "Don't worry, we're going to help you. We're going to work out this situation." And we did. She was all afraid that it was going to cost a lot of money to have him transferred to a facility there in Hemet, but it was all worked out. It didn't cost a lot of money, and we got him moved closer to her. And so this is what it's all about. There's lots of challenging cases too, but those are some good things.
Well, people are, I think, familiar with adult protective services. And so what is the difference, just so our audience can understand, between the Ombudsman program and Adult Protective Services?
Well, if a person is in a facility, we don't really, the Adult Protection Services takes care of people that are not in these facilities. So if, like, for say, if a facility discharged a person and it wasn't a safe discharge, we didn't feel it was safe to wherever they were sending them, we would call Adult Protection Services to do a wellness check, to check on them, to let them know what had happened. And then they would follow up from there, or law enforcement also.
So one of the differences is Adult Protective Services does have law enforcement, if you will, capabilities. And would the same thing happen if you're really not able to resolve an issue with the facility that you're working with? Is that something that you would also refer to another agency?
Yes, if they're outside of the facility, but inside the facility, we would refer to, well, yes, we would refer to law enforcement, not so much APS, but we wouldn't, if it's like an abuse case of some kind or financial abuse, it would go to law enforcement and, or what was I going to try to say, Mary?
Department of Public Health.
Oh yeah, I'm sorry. It would go to licensing, and the Department of Public Health is over the skilled nursing facilities, and the community care licensing is over the assisted living facilities. So that's where we would refer these problems to.
So if someone wanted to volunteer, and again, I apologize for the technical difficulties of doing this from home, is there a different number that someone would call if they wanted to volunteer for the program?
Yes, yes, yes.
Okay.
Happy to have that number. If you need to volunteer, you're going to contact Anita Johnson. She is our trainer. And actually, the number you were going to call is the same number to get on the Ombudsman line, which is 772-6624, and then ask for Anita Johnson. Or I'll give you her email, which is A, and then Johnson, JOHN as in Nancy, SON as in Nancy, at M as in Mary, B as in boy, IR, S as in Sam.org. That's her Ombudsman email. So yeah, give her a call. She's does all the training, and we're getting a new one. It's really soon, which is going to be awesome.
But we can use many more. We can use many more.
Yes, because each one of us has about 20 some odd facilities that we oversee, and it's so hard, to get to them all. So, and spend the time that we would like to spend,
Well, it sounds like a really rewarding opportunity for volunteers that want to really make a difference in their community. From some of the stories you just told, I'd say you're angels in our community, who can really make a difference in people's lives and the lives of seniors, and also help relieve some of the anxiety that family members may have when they reach that difficult decision to put a loved one, or to suggest a loved one go to an assisted living or care facility, that there's someone out there that's that there's someone out there that's going to be watching out for their loved one.
Exactly. Yes, exactly. We want to relieve that, to have them call us. And I was going to also tell you, so we're able to go into the facilities. It's a federal and state program, and they can't keep us out. So, and even with the COVID, we're able to go in. We are tested every week so that we have negative tests before we go in, and we have full PPE that we wear when we go in. Let's see, what else did I want to tell you about that? Well, I wanted to also talk about the importance of visitation. It's really important that the families can go and visit these people because they're so isolated and it really takes a toll on them. And we work with the facilities to help with the activities so that they provide a lot of activities and help them contact the family and the loved ones to make sure that they're doing that. And we encourage actually family councils. We can't start those up as ombudsman, but we encourage the facility to start those because if those families are interacting with each other and talking to each other, they can help to things improve at the facility. So you might ask the facility, that you arrange that if you can, through email. Mary, can you think of something else? It seems like there was something else I wanted to bring up.
I think you've covered it. One thing I want to say is don't let age deter you from becoming a volunteer. I'm 70 years old, still spry, and as long as I can carry myself on my 2 feet, I will be in the facilities. So I encourage you. We have 2 gentlemen volunteers that are in their 80s, and they are superb. And I think because of our age, we understand a little bit more about what the residents are feeling and what the families are feeling.
Yes, totally.
Mary, I really want to thank you. I've never had 2 guests with the same name. I really want to thank you for giving us this information and for all the work you do out in the community. We will do what we can to make sure people get this information, and it will also be at our front desk for information referrals if individuals call the Jocelyn Center. So they can visit the Jocelyn Center or call us at 760-340-3220 and ask for that information. So I really want to thank you for the work that you do, for letting us know about the Ombudsman program for long-term care and assisted facilities. So I really appreciate your taking the time. Again, I apologize for some of the technical difficulties and what can happen when we live here in the desert. So
Thank you so much for having us.
Yeah.
Also,
don't hesitate to contact us, please. So
okay.
that you'll be giving them the information, right? So
Yes.
okay.
Thank you.
So thank you very much. Have a great weekend. To all of our viewers, have a great weekend, and we will see you next week.
Okay.
Goodbye, everybody.
Bye.
This hand. Goodbye.